Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about the circumcision decision. If you have a son, you'll have a decision to make after he's born, whether he'll be circumcised. When a baby boy is circumcised, the foreskin, which covers the round tip of his penis, is removed. At birth, the foreskin is completely attached to the penis. Over time, it separates from the head of the penis and can be pulled back. Sometimes the foreskin doesn't separate when it should and remains tight. This is called phimosis. Usually phimosis requires circumcision to correct it. Circumcision is relatively simple and has few complications. It's the most common surgery among male babies. In the United States, up to 60% of all baby boys are circumcised. However, it's not unusual today for a couple to decide not to have their son circumcised. Whatever decision you make, you and your partner should make it together. Work this out before baby is born so you can understand and agree on what steps to take after baby's birth. Circumcision began as a religious rite. Today, people get circumcised for religious, medical, and cultural reasons. Jewish and Muslim people perform circumcision as part of their religion. In the Jewish faith, circumcision, called a bris, is done when a baby is 8 days old. Muslims perform the rite at 6 to 7 years of age. Typically, circumcision is done a day or two after birth in the hospital and heals completely in around 10 days. It's best to do it as soon as possible. Delaying the procedure can make it riskier. It's done as a surgical procedure, or a clamping device may be used to remove the foreskin. The cost of a circumcision is usually between $250 and $400. Check with your insurance company to see if it is a covered benefit. A urologist, obstetrician, or pediatrician can do the procedure in the hospital. A doctor can also perform it later in the office. In a Jewish bris, a trained professional called a moel performs the circumcision in a religious ceremony. Other than for religious purposes, infant boys are circumcised for two reasons. The main reason many couples give is they don't want their son to look different from his father or other boys his age. The second reason is health-related. A circumcision can reduce urinary tract infections, UTIs. During baby's first year, the incidence of UTIs is 1 in 100 for an uncircumcised baby, compared to 1 in 1,000 for a circumcised infant. Most parents are concerned about the pain a child may experience with the procedure. The American Academy of Pediatrics states pain relief is essential when a newborn is circumcised. Various techniques are recommended, including dorsal penile nerve block, the subcutaneous ring block, or a topical anesthetic cream. Risks with the procedures are minor and include some bleeding and local infection. The wound usually heals in about 10 days. You'll need to care for the penis as it heals. With each diaper change, clean the penis with water, then lightly apply petroleum jelly. Do this with every diaper change. The tip of the penis may be red and there may be a small amount of yellow fluid. This is a normal sign of healing. Circumcision has several benefits. It can impact penis health and improve hygiene. A circumcised penis is easier to clean and wash, especially for young boys. Specific health benefits include a lower risk of some penile disorders and penile cancer. There is also less risk of sexually transmitted infections, urinary tract infections, and penis infection and swelling. In addition, female sexual partners of circumcised men are less likely to get cervical cancer. The American Academy of Pediatrics and the American Urological Association have taken a neutral stand on circumcision. They have concluded there is no right or wrong answer to the question. The associations believe the decision is up to you and is based on medical reasons and your cultural and religious beliefs. There are some cases when the doctor may recommend delaying circumcision or not doing it at all. This may happen if your baby has medical concerns or physical problems with his penis that may need surgery. Sometimes surgeons will need the foreskin to correct the problem, and if baby was born prematurely, circumcision may be delayed. If you decide to have your son circumcised, performing the surgery at this early age will have little effect on him. Postponing it until later years can be more painful and carry higher risks. If you decide not to have the procedure performed, your child will not be the only child who is uncircumcised as he grows up. Statistically, over a third of his male friends and acquaintances will also be uncircumcised. Circumcision requires surgical permission from you and your partner, so it won't be done without your consent. When you meet with your pediatrician before baby's birth, you'll want to talk about circumcision. If you don't have that opportunity, you can always discuss it before baby leaves the hospital. If you'd like to read about baby, check out our book, Your Baby's First Year Week by Week. We cover many of these after pregnancy subjects that deal with baby in the book. We know you're busy and you may not have much time to devote to reading, but our book covers baby's development and growth in a weekly format, so you don't have to digest too much information all at once. Each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topic lists on the website.